Hi, everyone. It's Alex Savage from KTVU, Fox 2 News in the San Francisco Bay Area. And we want to talk today about back to school time here in the COVID-19 pandemic and what this means for students, especially in terms of stress and their mental health. And to talk about some of those issues, I want to bring in Dr. Hansa Bhargava, a pediatrician and the senior medical director with WebMD. Dr. Bhargava, always good to have you.
Glad to be here, Alex.
All right, it's back to school time all across this country. Kids are, in some cases, they are heading back into physical classrooms, but it seems that most kids are heading back to school in a virtual way and continuing to do distance learning. No matter which route a family is going down right now, whether they're sending a child into a classroom or they're doing distance learning once again from home, it is a stressful time for everyone involved. What are the best ways you think for parents and for students to deal with just all of the challenges and the stressors that come along with going back to school at this time in our country?
Yeah, and I think that's, as you said, a lot of parents are struggling with that, and it is not easy. It is not easy. The kids have been out of school or not in a structured environment for 5 to 6 months. So, we're all chomping at the bit, but unfortunately, the safety of the community is really, really important. So here's what I usually tell my patients, and that's really the 3 S's. So the 3 S's really, as they go back to school virtually, are structure, make sure they have enough sleep, and then do self-care both for the kids and for you. So let's talk about structure. So just because the kids are doing school at home, it doesn't mean that there shouldn't be structure. So we should probably have the kids wake up on time, get their breakfast, brush their teeth, put their clothes on, and get in front of the computer. And, for older kids, it'll be different. For young kids, it'll be different. But, some supervision is obviously necessary for younger kids. So that's the first S, Alex. And I would suggest that strongly for the families.
All right, and what about the parents in terms of trying to manage the stress that comes along with working from home, and then once again trying to manage your student or students maybe who are trying to make their way through a school day from home. What's the best advice you have for parents to navigate this?
Great question. So I think setting expectations early is a good idea. So for older kids, having that conversation that you might actually be working, if you're lucky enough to work from home, then you might be working from home, and you're letting the kids know that there's certain times where you'll be checking in, and other times, you might be in meetings and you don't want to be interrupted. If you are, if you do have to leave for work, then unfortunately, and I do think the parents are carrying a lot of burden here, Alex. One parent may need to stay at home, or you may get together with a couple of other families and see if you can do what they call pods. But then I would caution that just do the pods with only those 2 families, and make sure it's not really a large group, but maybe a group of 8, and then maybe one parent oversees that learning supervision. And some people are doing that across the nation as well.
What are the warnings? What are the signs that I should look for in my child to know that all of this, the pandemic and everything that's come along with it, and now once again being sort of thrust back into this distance learning environment, how do I know if that's taking a toll on my kid?
Alex, I think it is taking a toll on all of us. Let's be honest. I think,
Sure.
the
Yeah.
social and emotional aspect of this is hard. It's really hard. It doesn't mean that we haven't been through bad times before. We've been through flu of 1918, the world wars, 9/11. I think this is the time that will be remembered for a very long time. However, I think it's really, really important to talk to the kids about it, to talk to them not only about the school issue, but also the COVID issue and what that means for them. And then even at the beginning of the school year, it's a great time to kind of touch base with them and say, what is COVID? How are we going to do this? What are we supposed to do? And what are the rules around that? And the second part of the course is managing the stress.
Lastly, on the distance learning aspect of this, I think one thing as a parent that I sometimes step back and think about big picture is what might be the long-term effects in terms of, my kids' mental well-being and mental health, but also in terms of, the education that they're getting during this time. And are all these students, are they sort of going to fall behind in some way because of the fact that they're not able to be there in that classroom environment.
Yeah, and I do think, we will take a little bit of a hit that way. I'm not an educational expert, but certainly even a summer away is called the summer brain drain by teachers. So I do think that, 5 or 6 months away, or maybe it was 4 to 6 months, depending on your school district and how well they deliver the virtual education. But the positive side of it is that the schools have had the summer to prepare some educational curriculum. It's not like they were caught off guard in March when they had to shut down unexpectedly. So I think it'll be better. Having said that, I think the parents will need to pay attention to what's being taught and be advocates for their kids' education.
Yeah. All right. So the other side of this is that in some places in the country, not here in California, but in some places, there are students who are, heading back into classrooms for in-person learning already. And obviously that brings with it a whole different set of challenges and concerns that arise from there. We've been hearing some of the stories from different parts of the country where you have school districts that have kids returning to the classroom, and then you're having outbreaks of the coronavirus, and you're having schools shutting down. So a lot of that back and forth, that certainly can take a toll on kids and families. What would be your best advice to those families who are trying to maybe who are sending their kids back to school in person and facing some of those, obviously very real challenges?
Yeah, and it is a challenging time. Unfortunately, we haven't had a consistent message across the board. Every state and county seems to be doing something different. But that we have what we have. And I think for parents, the 3 pillars that I would rely on is, what is the infectivity rate in the community? How is a school actually going to handle making sure that your child is safe? And then what is your family situation personally? Are you living with grandma who's on chemotherapy for cancer,
Right.
or having a child who has special disabilities who may be on medicine to boost your immune system? So those are the factors that you kind of weigh in on to decide if your child goes back. And lastly, masks. I mean,
Right.
you want the masks and social distancing and hygiene. I mean, I would not send the kids back without making that a very important factor.
And I was going to ask you about that in terms of sending your child back to school. As a parent, before you make that decision or determine whether that's safe for your child and for your for your greater family, as you talk about, what are some of the biggest things that you might want to look at and analyze in terms of a school district's plan for in-person learning? What are some of the key things to make sure are part of that plan?
Yeah, great question. So I think some of the key things is really to keep the kids safe. So that equals masks, social distancing, the number of children in any cluster should be, really reduced. That's number 1. Number 2 is, how wedded is the school to the, to making sure that the community is safe, right? So if you send your kids back to school and all of that is true, then if there's 1 child or 2 children with COVID, that's COVID positivity, the whole school shuts down, right? And the classroom can shut down. So how wedded is the parents' community to making sure that they are aligned with trying to keep everyone safe? I think that's really, really important. Some schools have asked on, to have the parents sign an honor contract where they promise to send their kids to school if they're sick, if they're positive, and they won't mingle at sports with, giant groups of people, or not just sports, but any kind of gathering without masks and without following those rules. Because as soon as 1 child becomes sick, that exposes all the children that are in the class or in a larger gathering.
And how important is it for the district to have a clear plan and clear criteria for when a school or a whole set of schools in a district are going to close because of an outbreak? I mean, you want to know exactly what that criteria is, right?
This is the time where parents really want to dig deep and find out what exactly everything means. So ask those questions at the PTA meetings, at the school meetings. But, schools, what we could do is look at the schools outside of our borders who've been able to do it well, like in Europe, for example. And also, frankly, I think some states that are at a low rate are looking at this very critically. But to your question, Alex, I would say there should be phases. There should be, and some schools are calling them phase yellow, phase orange, phase red, where, they use certain criteria to decide whether it should be online, hybrid, or, physically in person. So I think those are great questions to ask. I asked the school the other day about if somebody becomes positive, what do you do? How do you find out who that child's been with? When do you quarantine everyone?
Mm-hmm.
Do you do contact tracing, or do you ask them to go get tested, or do you shut down the whole school? So these are the questions that are important to parents, I think.
Yeah, and do you think are schools going to need to come up with plans, testing plans of their own? Obviously there's testing that's happening in the community, but districts are going to want to have testing plans and I presume contact tracing plans as well to address outbreaks.
I think testing
on campus.
Yeah, I think testing and contact tracing is really important, and the schools should have policies around that. But I got to say, I think a lot of the schools are struggling with resources. I think you need resources for that. You need people for that. You need school nurses, and you need to make the plan. And I'm just going to say, I don't blame the schools. I think it's just they're between a rock and a hard place, and I think everyone is having a tough time right now.
Yeah, I'm wondering, my kids are, they're and folks here in California, I think for the most part are starting off the year. Pretty much every major district that I can think of is starting off the year with distance learning, and I in some sense I feel like we kind of hit the reset button a little bit with the summer, I think, which was good because everybody, parents, families, kids, educators, everyone got a chance to kind of take a breath, figure out, and then sort of jump back in with maybe a plan that was a little bit more formulated, and so that's so far I think that that's been good. I'm sort of sitting here wondering how much of a chance is there that at any point during this school year that things pivot to maybe bringing kids back into the classroom setting. I don't know. Do you think that's something that some districts might try?
Yeah, I think if the community rates are low and the school has a plan, that is, of course, the most ideal, Alex, right? They get structure, they get social time, even with masks and social distancing, you still get to see other kids' faces. I think that's really, really important. But I would even say at this time, this is a great time for parents to kind of try to become part of the conversation, to advocate, to even maybe your school needs fundraising. I don't know. We fundraise for school sports. So do they need some fundraising for what they need? These are the times to ask those hard questions, but
for PPE.
It's good to ask.
Yeah.
Well, there you go. The teachers deserve to be safe. But yeah, if we are fundraising for sports, why can't we fundraise for this, for example?
Yeah, sure.
And then other ideas where parents could be hall monitors to make sure kids wear their masks. Is there a way that digital companies could provide those kids who don't have laptops for hybrid learning?
Yeah.
Could some companies rent laptops? There's I think it's just innovation and out of the box thinking, which our country is so good at.
So, and let me ask you about how, we've heard a lot about how children, from all the data we have so far during the pandemic, that children are certainly haven't. It hasn't seemed as though they've become infected with coronavirus at quite the same rate, and they certainly haven't gotten the symptoms as severe as adults. But it does appear now, according to CDC data, that the infection rate in kids is now beginning to tick up. They're seeing a marked increase from March until July. So let me ask you about kids and getting coronavirus and getting sick from coronavirus, because we've heard since the pandemic began that kids tend to not get as sick from the coronavirus. There's sort of a notion that they're not as affected in the same way, but now there's some new data from the CDC over the past few months. They're seeing the rates of infection in children increasing steadily between March and July. So the question is, how concerned should we be seeing that? What do we attribute that to? And how is that going to factor into the potential for getting more kids back into classrooms for in-person learning?
Yeah. And the numbers of children being infected have increased, but I do think that's because of summer activities, people going out, getting together, Memorial Day weekend, July 4th weekend, the pools, and now, of course, school starting, right? I think still overall, the number of kids infected are probably less than 10% of everyone infected. So there's that. And also just wanted to say, like, the mortality rate, i.e., God forbid, children's dying, actually are still less than 1% of people who are dying. So I just want to put that in perspective. Sure. But yes, of course, the numbers are going up, and it's really important for us as parents and schools to be careful, because we don't know that kids don't infect others either. And over the age of 10 to 12, they actually seem to have the same infectivity rate as adults do. So they could infect other people. Under the age of 10, it seems that they don't really infect other people as much.
Yeah. But of course, I mean, right. There's so much we don't know still, right? We're just constantly learning new things about this virus and how it affects people and how it spreads. So, just another, just another sort of revelation here as we start to see more kids get sick. But it is good to keep it in perspective. Well, I certainly will say, as a parent, I'm hoping that we get to transition to a classroom setting here, but obviously none of us want to do it until we know it's safe to do so. So we'll
I think it's a personal decision, Alex, and I think it really depends on the community infection rate and how comfortable you feel with the school policies. So.
Absolutely. Yep. All those factors have to be taken into consideration. Always appreciate your time. Wish you all the best. Dr. Hansa Bhargava, pediatrician and Senior Medical Director with WebMD. Thank you so much for coming on and for talking about back to school time, a very different back to school time all across this country. Wish you and your family the best. I'm Alex Savage from KTVU Fox 2 News in the San Francisco Bay Area, and I will talk to you next time.